Mr. Morris.
Good morning.
Typically, you will perform a comprehensive physical examination on new patients or patients being admitted to the hospital. This provides fundamental knowledge about the patient and helps identify or rule out physical causes related to your patient's health concerns. A skilled head-to-toe examination of adult patients requires a thorough knowledge of the techniques of examination for each region of the body. You should be prepared to detect normal variations and abnormal findings. The patient's health and well-being should be the primary focus of the examination, but you must promote the patient's personal comfort as well. Take time to adjust the examining room's environment prior to the examination, making changes in lighting, sound, or privacy, for example. By demonstrating respect for the patient, you promote the patient's comfort and relaxation, which helps ensure a successful examination. Another key to patient comfort is your attention to proper draping during the examination, combined with communication about your intentions as you move from one regional examination to the next. Your patients will appreciate knowing why you are adjusting their gown or causing them even minor discomfort. Minimize the number of times you ask the patient to change positions, from sitting to supine or from supine to standing, for example, to assure patient comfort. Developing a systematic sequence of examination greatly aids your ability to conduct an accurate physical examination with thoroughness and efficiency. With experience, you will acquire a routine that works well for you and for the patient. With the patient's health history in mind, and after good hand hygiene, you are ready for the physical examination. For a healthy patient, a complete head-to-toe assessment should take beginning students about 20 to 30 minutes. With the patient sitting, begin your assessment with a general survey, inspecting the patient closely, literally from head to toe, in order to form impressions for your later written assessment. Note characteristics such as apparent state of health, ease of breathing, height, build, and sexual development. Obtain the patient's weight. Note posture, motor activity, and gait, as well as dress, grooming, personal hygiene, and any odors of the body or breath.
Okay, very good.
Observe the patient's facial expressions and listen to the patient's manner of speaking as you note his or her state of awareness. Now measure vital signs. When measuring blood pressure, select a cuff of the appropriate size and position the patient's arm properly at heart level. This will help ensure an accurate reading. Record the patient's heart rate by checking the radial or, in older adults, the apical pulse. Next, check respiration. Listen to the number of respirations per minute by subtly placing the stethoscope over the patient's trachea. Next, check the patient's temperature. 3 methods are commonly used: oral, via the tympanic membrane, or at times rectal. Oral temperatures are the most common, but should not be used for patients who are unconscious, restless, or unable to close their mouths. Begin inspection of the patient's skin by observing the patient's face. Assess the facial expression, skin moisture or dryness, any facial swelling or asymmetry, and check for any cyanosis in the lips. Inspect and palpate the patient's fingernails, looking especially for any clubbing or cyanosis. Continue your assessment of the skin as you examine the other body regions. Note color, pigmentation, texture, hair distribution and thickness, and any lesions. Look for nevi, scars, or other distinguishing characteristics, noting their placement and dimensions. When you see nevi or moles, assess for melanomas using the ABCDE method. Inspect for asymmetry, irregular borders, color variation or change, especially blue or black, diameter larger than 6 millimeters, and elevation. If any of these 5 aspects is present, consider referring the patient to a dermatologist for further evaluation. In sun-exposed areas, flaking ulcerated lesions are suspicious for a squamous cell carcinoma and shiny raised lesions for a basal cell carcinoma. Next, assess the head, eyes, ears, nose, and throat. Palpate the scalp, looking for any depressions of the skull, which might indicate head trauma or previous surgery. Inspect the hair and its texture, looking for nevi, lesions, or even lice. Inspect the face. Note whether the facial expressions and eyebrows are symmetric.
So I'm going to turn the lights out and we're going to check your pupils, okay?
Check the color of the conjunctiva and sclera, looking for pallor in the conjunctiva or icterus in the sclera. Inspect each cornea, iris, and lens, noting any injection of the cornea, especially around the iris. Compare the pupils and test their reactions to light and accommodation. With an ophthalmoscope, inspect the ocular fundi, checking carefully for sharpness of the disc margins and especially any blurring of the margins, suggesting papilledema, shown here. Next, examine the ear canal and drum using your largest ear speculum and holding the otoscope at an upward angle. Check auditory acuity. If acuity is diminished, check lateralization using the Weber test, and compare air and bone conduction with the Rene test. Next, inspect the anterior and inferior surfaces of the nose. Note any asymmetry or deformity. Then, inspect the inside of the nasal passages with an otoscope. Palpate for sinus tenderness by pressing up on the frontal sinuses from under the bony brows, then press up on the maxillary sinuses.
Okay, I'm going to check your mouth, your lips.
Inspect the mouth, observing the symmetry, color, and moisture of the lips, and note any masses, ulcers, cracking, or scaliness. Inspect the oral mucosa and note the color of the gums, normally pink. Inspect the gum margins and the interdental papillae for swelling or ulceration. Inspect the patient's teeth and look for abnormalities. Inspect the hard and soft palates, the uvula, tongue, and other structures of the mouth. Pay particular attention to the floor of the mouth and the sides and undersurface of the tongue, for here is where leukoplakia or cancers can develop. Next, you may wish to perform a brief assessment of the 12 cranial nerves while the patient is sitting and facing you. Cranial nerve 1, the olfactory nerve, is typically not tested unless a neurological problem is suspected. In the head-to-toe assessment, cranial nerve 2, the optic nerve, can be assessed with a test for visual acuity by using a Snellen eye chart. Pupillary response was tested earlier. Cranial nerves 3, 4, and 6 control extraocular movement.
All right, I'd like you to look straight ahead, just right over my shoulder. And then I want you to follow my finger, okay? Excellent.
Next, test for the several components of cranial nerve 5, which includes motor response, sensory response, and the corneal reflex.
All right, I'd like you to just clench your jaw for me. Okay, very good. And then I'm just going to check sharp and dull.
Okay.
So tell me if you're feeling anything brush your skin. Just say yes or no.
Yes.
Cranial nerve 7 is assessed by inspecting the patient's movements of facial expression.
Raise your eyebrows for me. Good. And relax. Squeeze your eyes tight shut. Good. And puff your cheeks. Relax. And show me your teeth. Excellent.
Next, assess cranial nerve 8, which is responsible for hearing. Test one ear at a time.
I'm going to whisper in your ear and tell me what you hear.
21.
Excellent.
14.
Very good.
Assess cranial nerves 9 and 10 by listening to the patient's voice. Is it hoarse, or does it have a nasal quality?
Open your mouth.
Here, you'll also ask the patient to say ah, or to yawn as you watch for symmetric movement of the soft palate, uvula, and the interior and posterior pillars and pharynx. For cranial nerve number 10, warn the patient that you are going to test the gag reflex. Then, stimulate the back of the throat lightly on each side in turn. Assess cranial nerve 11 from behind the patient. Look for atrophy or fasciculations in the trapezius muscles. Ask the patient to shrug both shoulders upward against your hands. Note the strength of the trapezius. From the front, ask the patient to turn his head to each side against your hand. Observe the contraction and force of the opposite sternomastoid and note the force of the movement against your hand. Assess the 12th cranial nerve by inspecting the patient's tongue for atrophy or fasciculations.
All right, I'd like you to stick out your tongue for me.
Then, with the patient's tongue protruded, look for asymmetry and deviation from the midline. Once you have completed any assessment of the 12 cranial nerves, inspect the neck by palpating the anterior and posterior cervical lymph nodes. For each node, note its size, mobility, and any tenderness. Note any masses or unusual pulsations in the neck. Next, palpate in the sternal notch to check the position of the trachea. It should be midline. Ask the patient to take a sip of water and inspect for the thyroid gland as the patient tips his head back, then swallows.
Just hold it in your mouth. Okay.
From in front of the patient, inspect and palpate the region below the cricoid cartilage for the thyroid isthmus and for any glandular enlargement.
You can lower your head. I'm just going to feel for the...
Repeat, standing behind the patient.